Hello, everyone. I'm Arya, your host for today's session, and welcome to the FB Live, where we'll be talking about diabetes management and the modern treatments. If you're Indian origin, living in the US, and worried about your medical needs, well, eGlobalDoctors has your back. We have introduced package deals for you and your family members. So now get yourself consulted at lower costs, where you can choose from our 300 plus board certified doctors from USA, India, UK, and other parts of the world. Prescription will be provided. Response time is 1 to 3 days. Video consultation is up to 30 minutes. These packages can be used by yourself or your family members. For more information, visit www.eglobaldoctors.com and register yourself now. In today's FP Live session, we'll be exploring and providing more information about how we can diagnose diabetes early, the preventive measures, managing diabetes, and the modern treatments available. We have with us today Dr. Veena Watwe. She is in private practice and has been working as a consultant endocrinologist in Houston, Texas from last 13 years. She has a fellowship in endocrinology from Wayne State University and residency in internal medicine from State University of New York, Buffalo. Welcome to the live, Dr. Veena. A very good morning to you. How are you doing today?
Thank you. Thank you, Arya, for that wonderful introduction. I'm doing good. It's Sunday morning here. So yes, I'm doing very well. Thank you.
Great. So without waiting any longer, let's dive right into our first question. What are the factors contributing to diabetes and how do I know that I am at risk?
So there are several factors as a risk of diabetes. You know, there are certain things that are in your hands and there are certain things that are not in your hands. So the things that are not in your hands, we'll go over that first. You know, first is your ethnicity. So unfortunately, we Indians are blessed with certain genes or genetic factors that are not quite conducive to diabetes. You know, we are at risk for diabetes, you know, just because of our ethnicity. So you don't see much bigger people in India, but I mean, compared to what I see in US, I mean, here we see a lot of people who are like 250 kilos, you know, 225 kilos, and they may still not have diabetes. Whereas in India, there are people who are not as big, but they still have diabetes. They're on insulin, so many things. So unfortunately, our ethnicity does make us predisposed to diabetes, and you can't do anything about it. We are Indians, so it is what it is. And then the second factor would be family history. We cannot choose our ancestors. We cannot choose our parents. So that's not in your hands. And if you have family history of diabetes, yeah, you are at risk. And majoritarily, I'm talking about type 2 diabetes here. And the things that you can do to prevent diabetes or make sure you're at less risk is eat better, do exercise, keep your weight in check. That is the number one thing. Nowadays, with Western diet, Western lifestyle, people are very busy in their careers. They come home late. There's no time to eat well. They're eating outside. They are not exercising. So diabetes has become quite rampant. The graph has gone up quite steadily over the last several years. So that is the main thing, and we can go into more details of that. But type 2 diabetes comes from insulin resistance, which comes from being overweight or obese. So number one thing that you can do is eat better, a low carbohydrate diet, which will help you not gain weight and help you reduce your risk of insulin resistance and reduce your risk of type 2 diabetes.
So you said ethnicity or the family history can be a contributing factor to diabetes. So then what are the common symptoms that you might see as the diabetes detection, or how is it diagnosed?
So many times you may not even have symptoms. So there are several people who will come to me, they went for a physical and they had a sugar of 300, and that is the first time they have ever known about it. So unfortunately, diabetes is a slow killer. You know, you may not sometimes have symptoms, and it might take you by surprise. And other common symptoms, I mean, that may happen that you should watch out for would be increased thirst. So high sugar levels is a high concentration, it leads to high concentration of blood, which is what leads to increased thirst. which leads to increased urination. The sugar gets spilled through your urine and it pulls all the water with it. So you will have increased urination. So if you're waking up in the middle of the night, going to the bathroom 5, 7, 8 times a night, then that could be a sign. Losing weight. In extreme cases, you may have weight loss, unexplained weight loss, and you may just start feeling ill. So these would be some of the extreme symptoms. Blurry vision is one of them. So everything is going well, you don't know, you go to the doctor and no prescription or nothing. And that's when you get diagnosed with diabetes. The only symptom would be blurry vision. But unlike some of the other diseases, sometimes it may take you by surprise. And that's why, you have to be on the lookout and go for physicals, once a year physicals. It's not a very common thing that people do in India, but it would be helpful if you can go and do, especially if you're predisposed and you have type 2 diabetes history in the family. After a certain age, say you're 30 or 35, you should go and get a physical, at least get basic blood work done once a year. And I know some people in India don't even go to the doctor unless they have some infection or some viral infection or something, fever or something. So here, I think in the US, I think physicals are covered. So people are a little more used to going to the doctors at least once a year. So I would recommend that at least get your basic checkup done at least once a year.
Right. So you mentioned the word type 2 diabetes right now a couple of times. So exactly how do we differentiate between type 1 and type 2? And are there any more types to it or just these?
So the basic difference between type 1 and type 2 is that type 1 diabetes gets diagnosed early in life. This would be right from babies. It could be diagnosed in babies, very unfortunate, but like as old as 6 months to early adulthood, say teenagers, early 20s. And the physiology is completely different in these people. Their pancreas is not working because of, there are theories why it stops working, but there are theories that it's viral, virus attacks the pancreas. It's an autoimmune disease. So essentially, but for all practical purposes, their pancreas is not working and they cannot make any insulin. So they have to take insulin shots in order to survive. If they don't take insulin, they will die. So that's a much, much more serious disorder. Their fluctuations in sugars can be quite a lot. And it has to be managed, very meticulously. And as a child, that can be very challenging for the kids, for the parents. There are newer advances now, the newer technologies, which check the blood sugars continuously, and there are insulin pumps. So life has become easier, but as a type 1 diabetic, the life can be quite challenging. Type 2 diabetes, on the other hand, is because of, as I said before, majoritarily because of being overweight or obese. There are the other factors, as I had mentioned, family history as well as genetics and all those things too. But majoritarily, it is what we do to ourselves, unfortunately. The type 2 diabetes prevalence has gone up over a period of time because, we are not taking care of ourselves. Previously people would eat, a lot of carbohydrates, but then they would work in their farms and, they would wash their clothes and whatnot. Now we all have bodies and, nobody does any work at home, or they don't exercise. Most people are busy in their own careers. So it comes from insulin resistance. There is no lack of insulin. In type 2 diabetes, at least initially, there is no lack of insulin. Because of the fat in the cells, in your muscles, in your liver, because of the fat in the cells, the cells become resistant to insulin. So insulin is trying to draw that blood sugar in the cells, but it's not able to do that because that receptor on the cells is resistant. So that's why when we say do lose weight or exercise, the idea behind that is that you would lose the fat, and that will help the receptor to open up, and that will draw the sugar in the cells. So as I said, the physiology is completely different. In type 2 diabetes, the physiology is insulin resistance. And as you progress, it may so happen that, the pancreas finally gives up. It's trying to make up for more and more insulin. And one fine day, it may give up, and you may need to be on insulin at that point. So type 2 diabetes people also may need insulin, but those are the extreme cases where they are uncontrolled, and that's why they are needing insulin, unlike type 1 diabetes, where they need insulin to survive. Now, talking about other kinds of diabetes, there is something that we endocrinologists call as type 1.5. We don't have to go into details of that. If it comes to that, believe me, you need to see an endocrinologist by that point. So 1.5 is a little bit of a mixture of both, but again, it can be a little challenging to diagnose that, and that should be left to the experts. So no need to go into the details of that, but just for general purposes, we can, divide it into type 1 and type 2.
Okay. So like if I'm not aware that I'm diabetic or not, and I go for a blood test, so what should my fasting and normal blood sugar be?
So a normal person fasting, meaning nothing to eat for at least 8 hours, their blood sugar should be less than 100. We say you're a diabetic if the fasting sugar is over 126. Now, there is something like pre-diabetes or insulin resistance. I mean, there are different names for this. If the fasting blood sugar is between 100 and 126, we call it pre-diabetes. At no given point should your blood sugar be over 200. If your blood sugar is over 200, you have diabetes. There is no question about that. So yeah, that's what the fasting should be. And then 2 hours after a meal, we call that postprandial. That should be less than 140. And I know in India, they like do the fasting and PP. They go tell people to go home and eat a meal and come back and check their blood sugar after 2 hours, which is fine, but that doesn't become as standardized as, here we give a glucose drink. Where you know exactly how much sugar or how many carbohydrates are in that drink, and then you check their sugar 2 hours after. This is for the glucose tolerance test. I'm talking about glucose tolerance test, which is used for diabetes diagnosis. But in India, I know there's a lot of people who do that PP thing, PP sugar, postprandial sugar, where they just send them people home. And I just want to warn people that there's not as much standardization there. And maybe my Indian colleagues may not like this. And I think that's still happening. I mean, I may be wrong, but I think that's still a standard of practice there, to come fasting and then go home, eat, and then come back. So you should ask your doctor what kind of diet should they go home and have, because some people may eat only rice, some people may not eat rice. So many factors can change with that kind of testing.
So you said 200 should be the number. Like if it exceeds 200, then you can know that you are diabetic.
Right, a random blood sugar over 200.
You got it.
That's
Okay.
diabetes. Fasting, as I said, normal people do less than 100. To have diabetes, 126 or more is diabetes, no questions asked. And in between 100 to 126 would be something in between, which is pre-diabetes, which means you still have the risk factor. You're not off the hook. You have to start dieting and exercising and all that. So pre-diabetes is still, it's just a marker. It's not like you are saved or anything. I mean, it's a warning that, hey, you need to start dieting and exercising because it's heading towards diabetes.
Right. So now suppose it exceeds 200 and then I know that I am diabetic. So then what are the general dietary guidelines that I should follow?
So again, I hate to say this, but our Indian diet does unfortunately have a lot of carbohydrates. We live on rice, chapati, potatoes. Our every snack has potatoes. Sago and suji and everything. I can't think of a snack that does not have carbohydrates. So we do eat a diet which is very heavy in carbohydrates, and that is what that needs to change, unfortunately. Especially if you're a vegetarian, it does get very challenging. I mean, it does get very hard. You are left with very few things to eat. Basically, vegetables, pulses, dal. Pulses and dal also have some carbohydrates, but less compared to your chapati and your rice. If you do eat meat, you should eat meat, chicken, fish. Chicken and fish is better than red meat. Red meat has been linked to more heart disease, has been linked to cancer, colon cancer. So it would be better to stick to chicken and fish. And by chicken and fish, I do mean, more chicken and fish. The way we make it, it's a lot of curry and a small chicken piece in that. So not that kind of, chicken and fish. I do mean like a good portion of chicken and fish, because any of the meat does not have carbohydrates. Now, if you don't want to eat meat, that is okay. But then again, as I said, it does become challenging. You have to then restrict yourselves to salads, vegetables. You can have as many vegetables as you want. And by that, I do not mean potatoes. Vegetables generally have very less, carbohydrates. There are soups, you can make soups and fruit. One of the very big factor is fruit. People think, oh, it's natural sugar. It is okay to have fruit. Mangoes, it's natural sugar. No, it is still sugar. So this concept that natural is not a very, it doesn't hold truth. People I know that in India, they do tea with honey and tea with gur and say, oh, it's natural sugar. It's okay. I'm not eating processed sugar. It is still sugar. So best is not to have tea with, first of all, not to have as many teas. I know that people sometimes have 4 and 5 cups of teas. So first of all, not to have those many. And if you do, if you can restrict your sugar content in it, maybe not have any sugar. It's just a matter of what your palate gets used to. You just have to train your palate. That's all there is to it. So yeah, I mean, and in general, portion control. Whatever you're eating, eat less. Believe me, majority of us eat much more than what we need to.
That was very good that you touched upon that point, because I have seen many people drinking tea with jaggery instead of sugar and saying that it's less sugary or less sweet, so it would do for a diabetic.
You're right. And best way is check your sugar. I mean, if you want to do your, own experiment that, hey, well, how much processed sugar raises your sugar and how much does jaggery do? Just check your sugar and maybe you're right. I mean, maybe that it doesn't raise it as much, but every person responds differently. But I'm just giving a more generic comment that if anything tastes sweet, believe me, that does have sugar. So there's no such thing as natural sugar is better. That's a different point that we are making, that with things that are processed. I mean, yeah, there is some data that it may cause cancer. There's that, so that's a different point. But strictly speaking, from sugar perspective, it is still sugar.
Absolutely. So for someone who has like diabetes and they has a job which requires travel all day, so what foods would you suggest, like can he or she consume on the go and just have it even if they have diabetes?
So just like I said before, it does get very challenging. If you're, traveling, then you're staying in a hotel, and hotels, obviously they want to market well, so they will have all the goodies there, so it does become very challenging. But if you restrict yourself to the vegetable portions and stay away from carbohydrates, eat the meat and vegetables and salads. Salad also, I don't think there is as much of a concept of salad. I think it's coming, but here people eat salad for a meal. That's not a concept in India. I remember even my parents, when they came, they were like, oh, what is this? Just this much, But a salad can be, if you fill it up with a lot of good vegetables and, a lot of things, it can be very fulfilling. So I think slowly that concept is coming in India and hotels in India as well.
Sure, yeah. We did touch upon a point of type 1 and type 2 diabetes. So in which case, or is there any particular stage when taking insulin becomes mandatory?
So as I said before, in the type 2, so type 1, as I explained before, they have to take insulin. If they don't take insulin for an extended period of time, they will have a complication called diabetic ketoacidosis, where they are sick to their stomach. They will be in the hospital needing IV insulin and IV fluids. And so that is, for type 1, it's mandatory. They have to, unfortunately, take insulin. In type 2 diabetes, majority of the people will start with pills and other medicines that are on the market. And slowly as it progresses, when it goes beyond a certain point, when your pancreas actually gives up and is unable to make any more insulin, that's when you will require insulin. So your doctor will tell you that, okay, we have exhausted our options. Now there is no other option left, but we have to start you on insulin. And there are different kinds of insulin. So depending on your how serious your disease is, you may be started on just one shot of insulin, which might be a long-acting insulin. And if it's more serious, if there's a lot of fluctuation in your sugars after meals, let's say, you may be started on short-acting insulin as well. And then that becomes challenging because you then end up on 4 shots of insulin or more. So yeah, I mean, best is, again, as I said, if you can prevent going to that stage with more diet, exercise, that would be helpful.